Go to the next slide. Thank you. Lisa, would you mind going to the next slide and well, thank you all for being here. I think we covered that one also. This is the information for continuing medical education credits. So for any of you interested in claiming those, the activity code is there. And then if you want to go one more slide, this should
Not,
be
there it is.
This is the information about how to claim those credits. So you have two options. One is to go to the WMed portal and log in. Um, and then the other option would be to text the activity code to this phone number. And I think that's probably the easier option. Just make sure you do it within 12 hours of this recording or of this presentation. And then once you do that, they'll send an evaluation, and that just has to be completed within 30 days. Um, I think Nyana's going to drop a link in the chat that has a little support information because this seems to be a very challenging process. And do not hesitate to reach out if it provides any issues because that seems to be a theme. And we'll show this again at the end for anybody who misses it. But maybe grab that activity code just in case. Okay, I think we're all set there. If you have any questions, just drop them in the chat. We can go to the next one. And from here, I will pass it off to Lisa. I think maybe just to frame the discussion a tiny bit. Our goal here today is to talk about the health impacts of climate change, why the climate crisis is a health crisis, why climate solutions are health solutions, and why your clinical story or research story or personal story it can illustrate that for people and how important it is. So we're hoping you take away some of those things and that you stick around to kind of learn about how you can share your story and workshop it a bit too. So thank you again for being here, and I'll pass it to Lisa.
Great. Thanks so much, Lauren, and big applause for Lauren for being our new executive director. I am thrilled, and I think MiCCA's in great hands by having her leadership. And thanks to my entire team because they've really done a great job. Thank you for being here. I think this will be a good discussion, and I hope it is a discussion. And then big thank you to our guest speakers. We have Pavan, and I cannot pronounce your last name, Pavan, but from Michigan Environmental Justice Coalition. I'm just going to go with first names for everybody. We've got Maya, who's a youth leader from Kalamazoo, who's going to tell us a story. And we have recordings from Jada, who's one of our team members and is from Detroit, an MPH student from at University of Michigan, and Kaylee, who's a nurse practitioner in Traverse City, who's going to tell us the story. So we're going to talk about why our clinical story as climate advocates is really our superpower. And then hopefully I can get, yeah. And I'm going to start with a story that always kind of shakes me. It was written by Stephen Perotti, who's an ER doc in Santa Rosa, and he wrote this in the New York Times. And what he said was, I think it's not advancing well. I must have missed the wildfire evacuation course in medical school. Learning how to move critically ill patients while flames literally lick the ground just feet away was not part of his residency training. Most physicians, and I would care to say any type of practitioner, never anticipated having to empty their hospital while smoke fills the halls and the sky glows red. Now that's a powerful story. And when a person tells that story, it creates an image and you feel the emotion with it. And I think if we can learn how to tell stories like that, it will really be helpful to us. But as practitioners, we also recognize that we don't want to overstate things. You know, we've been trained to be very careful to talk about peer-reviewed data and to make sure that anything we recommend is evidence-based. And I certainly adhere to that and appreciate that very much. But to kind of contrast a clinical story from data, I just want to kind of highlight this. This is from the CDC in August of 2023, and they were looking at the number of ER visits due to asthma during the wildfire period between April and August, and clearly showed when the wildfires peaked, emergency room visits peaked. So that's good data. We all understand that data. And we go, yeah, wildfires leads to increased incidence, or at least correlates strongly with an increased incidence of ER visits due to asthma. But when we're thinking about a story, sometimes we can evoke more emotion. So this is what it looked like during that time in June of 2023 in downtown Detroit. Thank you, Detroit Free Press, for this image. And I want to talk about a young woman who's the daughter of my husband's high school friend. She was an 18-year-old high school student who was in excellent health with the exception of occasional well-controlled asthma, who this past summer on a warm, humid, and smoky day collapsed on her way to an outdoor event and was emergently taken to the emergency department, but ended up unresponsive with a tube down her throat in the ICU on a ventilator. This beautiful young friend of the family tragically never regained consciousness and ultimately died several months later, being unresponsive. Now, can we say with 100% certainty that climate change triggered this fatal asthma attack? Well, maybe not, but what we can say is that the combination of warm, humid temperatures and wildfire smoke, both which are consequences of our changing climate, contributed to unprecedentedly dangerous air quality in the weeks leading up to this fatal asthma attack. Recounting this tragic and unnecessary fatal health impact leaves us with an impression that really is powerful, whether we're talking to our peers or we're talking to the public or we're talking to policymakers. Now, I want to touch on what is climate attribution. Well, that's a statistical scientific method that they're starting to use for health outcomes, in which you could, an observed outcome could be linked statistically with a principal cause like climate change. And the New England Journal of Medicine is starting to publish and cite attribution-based studies. And in this review, they cited the following paper, which basically looked at the heat dome effect that happened out west in the Pacific Northwest in 2021. And their conclusion was that that heat wave was virtually impossible without anthropogenic climate change. So that is an attribution statement, no equivocation. It caused in excess of 1,000 human deaths and a 69-fold increase in heat-related emergency room visits compared to the same period in 2019. So what I would suggest to us, and maybe you guys don't agree, we could maybe even talk about it, but in my opinion, if you take the clinical story and you marry it with peer-reviewed data, then we really have compelling stories to influence change. What I'd like to do now is, this is Kaylee Canizes, who is a MiCCA volunteer and a nurse practitioner, and she is going to tell us her point of view about why to tell stories. And I'm going to quickly stop share because I realized when I shared it, I didn't share the audio. So if I don't change that, you guys aren't going to hear a thing. So hang on. Oh, I did do it right. I did it right, and I don't have to go back. But here we go. Tell me if you don't hear this for some reason.
Hi, everyone. My name is Kaylee Canizes. I am a nurse by training. I worked in a hospital setting for about 6.5 years. I'm currently doing a year of AmeriCorps service through Public Health AmeriCorps at a federally qualified health center in the Traverse City area. I've been involved in climate advocacy probably for about 4 or 5 years now, with Michigan Clinicians for Climate Action, the Alliance of Nurses for Healthy Environments, and Citizens Climate Lobby. So it's an issue that I feel very strongly about, and have a passion for. So I am excited to be speaking to others who hopefully share that same enthusiasm for climate action. So the purpose of this webinar is just getting members more comfortable talking about the climate health intersection. And so Lauren asked me to share my perspective on this. So sorry I can't be here in person, but I want to start by sharing kind of 5 key takeaways that I've learned throughout the years talking to peers and lawmakers about climate and health, before I share my own stories. So the first kind of takeaway is you are ready to start talking about this. You don't have to be an expert on climate change to have these conversations with colleagues and lawmakers. Your credibility comes from your lived experience as a clinician and your knowledge of disease and how they can be exacerbated by the climate crisis. So that knowledge is very valid, and no one is asking you to be able to speak to, environmental science or anything like that. So that was, I think, the biggest, barrier concern that I had when I first started having these conversations was like, I don't know enough, but it's like, you do, about the health impacts, and that is enough. The second takeaway is we're very trusted voices. So as health professionals, we are very much trusted by our communities and society. And so with that platform, we are in a great position to speak up and have our message be very well received by really any audience, at least in my experience. The third takeaway is the moral imperative piece. Part of our duty as health professionals is to advocate in this manner for an issue that directly harms our patients and communities. So this very much aligns with our professional obligations at the end of the day. Fourth takeaway, storytelling is very, very powerful, and perhaps the most effective approach for conveying your message in a way that resonates with listeners, kind of humanizes the issue and puts it into perspective in a way that numbers cannot. And so your story enables people to, just connect the dots about the health impact of climate change much more than pure numbers or statistics, or focusing on broad generalizations. And then last takeaway is just always remember your why. You're here listening to this for a reason. And so when you feel, defeated, just remember that something compelled you to engage in this work, and remembering and honoring that really gives you the motivation to persist. So
we cut her off at that point so that we could go on to other stories. But golly, Kaylee is wise beyond her years, and I know I learned a lot from that as well, and I hope that you did as well. So I think as health professionals, there are really 2 key messages. These are the key messages that I hope you can take away. Number 1, fossil fuel pollution, just like cigarette smoking, opioid addiction, vaping, it is making people sick. It is killing people today, right now, here in Michigan. And it disproportionately impacts certain communities, and it has cumulative impacts. Number 1 message, we are uniquely situated to tell that message. And number 2 is the fact that almost anything you do to address climate change improves health. And that's a good news story. A lot of times people will close down when they only hear the negative. So having that positive framework is very, very powerful. So again, fossil fuel pollution is making us sick today. That's where we're going to start. There are cumulative impacts, and it disproportionately impacts communities of color, in particular in urban areas. So let's talk about what these impacts are. Number 1, what I do is I divide these into 2 broad buckets. And the first bucket are the immediate air pollution impacts of burning fossil fuels. The 2 big ones are ozone and particulate matter. And why I really separate this is that these pollutants in the atmosphere stay in the atmosphere a relatively short period of time, and they have very local impacts. So if we transition away from fossil fuels, we will improve air quality very, very quickly and improve and have health co-benefits very, very quickly. The longer term greenhouse gas emissions are naturally occurring gases. Their concentration is increasing very rapidly, too rapidly for life to adjust, living forms to adjust to that. And it will take much longer for those to come into equilibrium afterwards. And they have global impacts. So those are the two big buckets. And I would like to start with the air pollution impacts. When I think about air pollution, I often frame it as a type of secondhand smoke. It's harmful to our health, even if we don't take climate change into account. And there are two major culprits, ground level ozone, which is O3 here, and then fine particle matter. And it comes from heavy traffic and heavy industry and refineries and power plants that give off nitrous oxide and sulfide oxides and fine particles. They combined with some natural occurring compounds, heat and light, to produce these air pollutants, ground level ozone and fine particle pollution. And the fine particle pollution is very, very small, smaller than the cross-section of a hair, smaller than a grain of sand. And the smaller it is, and you guys know this, the smaller it is, the more systemic the outcomes. You know, lots of people who don't know better think it's only correlated with lung disease, but we know that it has much, much broader impacts than that. In fact, it's a leading cause of death worldwide. It contributes to about 1 in 5 premature deaths worldwide. And even after the Clean Air Act, it's about 1 in 20 premature deaths here in the US. And then beyond respiratory complications, there's a correlation to memory difficulties or dementia in the elderly, an increased incidence of preterm deliveries, low birth weight, and stillbirth in the US. So if we're thinking about both of those conditions, they leave long-term difficulties that families and have to live with for a lifetime. And then if somebody's exposed to COVID-19 and get infected, the higher the particulate matter is in their region, the more likely that they are to die from the COVID, according to a Harvard study released early on in the process. So that's fine particulate matter. Ground level ozone is a major component of smog. When I'm talking to audiences, I always try to differentiate that from stratospheric ozone, which is protective of the UV light. This is not good, and it's a major trigger to asthma. And importantly, as temperatures go up, ground level ozone goes up. So on warm, humid days, we have worsening air quality. And the American Lung says that ozone really gives you something like a sunburn in your airways. And you may remember, and I have to say this because I'm a pathologist, that those airways are surrounded by smooth muscle. And when you breathe in that horrible smoke, your smooth muscle contracts and it makes the diameter of the airways smaller. So it's harder for air to pass. And it gets clogged with mucus, essentially snot, also making air hard to pass. You take your inhaler, what that does is it releases the smooth muscle, opens the airways, and you can breathe again. Many, many triggers. You guys know this, but traffic is clearly one of them. Fine particle pollution from power plants and refineries is another one. And according to the most recent State of the Air report from the American Lung Association, nearly 1 in 3 people still live in counties where the air quality is frequently unhealthy. And these 6 counties received a failing grade in ground level ozone from the American Lung Association last year. And clearly, this is an issue that is magnified in terms of disparities. People of color are 3 times more likely to breathe polluted air. Black people are 5 times more likely to die from asthma, and Detroiters are hospitalized 4 times more frequently than Michigan residents as a whole. And if you look at traditionally redlined communities in many, many different cities and the rate of asthma going to emergency rooms, you see that you can just pick out the red line communities based on the number of people presenting in the emergency room due to asthma. So fossil fuel pollution is making us sick today. And there is a piece of good news with that. If we were to transition away from fossil fuels, fortunately, as I've mentioned, air pollution cleans up very quickly. This is New Delhi before the pandemic. This is after the pandemic. And because PM 2.5 tends to fall out of the air very quickly, that means those local communities will realize immediate health code benefits right away. And they come in the form of saving lives and saving healthcare dollars and increasing productivity at work and school. And those communities have had the hardest, historically disproportionately impacted, will also benefit the most, as it should be. This is an article that you guys can look at. It's from Jonathan Patz, and it just brings home what would happen if we were to transition away from fossil fuels. And we could, it's estimated we could prevent 50,000 deaths a year in the US, save $600 billion in healthcare every single year. And the impacts remain in the region where the emissions are reduced. There are local benefits. So air pollution is local and it cleans up rapidly. And that's one example of a climate solution that is a health solution. So I didn't do very many stories there, but we're going to go stories everywhere else. I just wanted to pause for a second and see if anybody had any comments, thoughts, questions, or anything else. And maybe if somebody's raising their hand or wants to offer anything, you can do so now.
This is Stephanie. I just wanted to, Lisa, this was wonderful. Just absolutely wonderful. Thank you. And as I mentioned to Lauren, I am in charge of the Great Lakes Environmental Festival, and we would love to have a talk like this or something next year. Our event is taking place this weekend, Saturday at Manistee High from 10 to 4, but we'd love to have something for maybe 2025. So let's stay in touch, please. Thank you.
Absolutely. Thank you, Stephanie. Anything else? Okay, let's dive into stories now. What we've done for the first half of this is talk about fossil fuel pollution, immediate local impacts in the form of air pollution. But let's go on to the greenhouse gas emissions and climate impacts. Now, climate is impacting our health in a myriad of ways. It's harder to grow food and access nutritious food. We are seeing more intense and more frequent toxic algae blooms. This is the water in Toledo in 2014. They couldn't use it for about 3 days. Heat is clearly going to be a big issue going forward, and we'll talk about that. As things get hotter and wetter, the seasons for ticks and mosquito and allergies get longer, and we'll talk about that. I talked about already that air quality gets worse as you heat things up, and all of these have mental health impacts. So we're gonna, this is a diagram that was put together by the CDC. I think the take-home message with this is that pretty much every aspect of health can be affected by climate change. But what I think is the most frequent manifestation of climate change in health, at least in Michigan now, is that it often acts as a threat multiplier, taking previously treated health conditions and creating external conditions that sometimes changes them into health emergencies. So it acts as a threat multiplier. And here's a quick example of this. This was a 70-year-old woman. She was doing really well. She had lung cancer, but she had a lobectomy, and they sent her home. And she had home O2. And she had lived at home for about a year until, guess what? You guys were just experiencing, many of us experienced this the other day, an extreme weather event. And guess what? Yes, power outages. And this woman did not have enough portable O2 to make it through the night. So she ends up in the emergency room that night, needing help to get through the evening. And we know extreme weather events are becoming more common and more costly. And we know in our area that rain and thunderstorms, but the amount of precipitation, whether it be snow or rain, has increased tremendously. Now, many of you have lived and experienced the Detroit flooding that kept happening in 2021 after, time and time and time again. My understanding is that there was flooding yesterday as well. And when those floods keep happening, one right after another, it's hard to get ahead of it and get your home cleaned out, and mold can sit in, and that can lead to allergies and trigger asthma and irritate your eyes and your mucous membranes. Flooding can kill people. This is Houghton over Father's Day in 2018. That was the third extreme weather event on the south shores of Lake Superior in 10 years. So not a once in a thousand year event like they described. It literally buckled the road and it killed one teenager on Father's Day. This is the dam in Midland that broke right after the pandemic. The dam was, old to begin with, but obviously the insult of rain did not help. And it's an example again of a threat multiplier. Because if you remember, at this point in the pandemic, there were no vaccines. We were in lockdown. We weren't supposed to go anywhere, but all of a sudden there's forced displacement of lots and lots of people from their homes. And so that's a way in which it can act as a threat multiplier. And then up in Traverse City, about the same time, the basement flooded and the first floor flooded. And if I'm not mistaken, that's where they keep the PPE, which is not a great news right at the beginning of the pandemic for healthcare providers. So now we have a story from Jada Robinson, who is on the team. And she grew up in Detroit, and she's an MPH student at the University of Michigan, and she's going to tell us her extreme weather story. So here we go.
Hi, my name is Jada Robinson. Although now I would be considered a public health professional, a lot of my climate health experiences are revolved around when I was growing up. For context, I was born and raised in Southwest Detroit. Whenever I would visit my grandmother's home, there would be flooding every time it would rain. Whether it was a rainstorm or a just subtle rain, the basement always flooded. Due to this consistency, there was mold within our basement, and that constant exposure led to us getting quite ill pretty frequently. We would get pneumonia, and eventually all of us were diagnosed with asthma. We feel that the asthma came from constant exposure from not just the mold, but also from poor air quality. And I feel like this connects with climate health in general because of the fact that these frequent occurrences are due to climate getting worse. As our climate gets in a poor condition, we as community members are just posed to exacerbated threats.
So well told story by Jada, and completely highlights how unfair things can be, and really nicely connects the dots. So we're going to end up with some time for people to craft their own stories. So as you're thinking about your stories, if you do the QR code, there's a Google form, you can look through it that is supposed to prompt you. But think about what extreme weather events you've seen and power outages and how your patients have been impacted, and that might form the basis of a story. We're going to move on to a couple other things. I hope you guys are sitting tight here, and I know it's just one story after another, but we're going to start talking about air pollution and increasing allergens. And we're going to talk about a story of a 23-year-old female from Allegan County. She comes into your clinic in late summer. She too has a history of asthma, and she had a recent COVID infection. She had been doing well on using her inhaler from time to time and had no serious problems, and even appeared to be recovering from her COVID infection without too much problem until last week. And at that point, the inhaler was no longer relieving her symptoms. And she was consistently having trouble getting her breath, even at rest. In fact, she was making audible noise when trying to inhale. I don't know if you guys have heard people when they have asthma and try to breathe against it, but it's heart-wrenching. Further investigation revealed that the air quality levels were poor. So it was poor air quality day with really high ozone levels. So we were thinking, what was contributing to the poor air quality, and are there factors at a distance that could be related to that? So as we move through this, a couple things to think about. We know that warming temperatures mean longer allergy seasons. Basically, the growing season is longer for these weeds. They start earlier in the year, last later. In Lansing, the average number of days has increased almost 28 from 1970 to 2020. And not only are the plants growing longer, but as greenhouse gas emissions go up, the quantity of pollen that's produced by the plant increases, and the allergenicity of the plant actually is worse. These graphs are from Climate Central, and they're showing the increase in pollen production from 2000 to 2020 and projecting it into the future. The dark green if we don't do anything, and the lighter greens if we start reducing our emissions. So we have a lot of power over what our health outcomes are going to look like going forward. So that was one contributing factor, just basically allergens in the air. And then another one was ozone. The air quality was poor. It was a hot day, and we know ozone gets worse with high temperatures. What I didn't tell you was that there was a wildfire, and the wildfire was at a distance, but we certainly know now that the smoke can travel a long way. In that situation, particulate matter increases. That would be pretty obvious, but what NOAA has found out is that ground level ozone can also increase at a distance from the original wildfire. And then COVID can just exacerbate that problem. Again, with small increases in fine particulate matter, the mortality rate increases. So again, what I would just stop and have you think about is, have you seen patients who are struggling with allergy, and how has heat and humidity and wildfire smoke impacted those patients? And those might be some stories that you want to consider telling. And these stories will be incredibly helpful to us because we're planning on anonymizing them, making a repository of them, and then potentially utilizing them when we're trying to educate our peers, educate the public, and importantly, educate policy members. Extreme heat. Let's talk about extreme heat. Well, heat kills. And in fact, we have another attribution-based study that showed that 37% of heat-related deaths in 43 counties over the last few decades they can attribute, and they use the word attribute, to climate change using that statistical analysis. So who's at risk? Well, pregnant women, the unborn fetus, newborns are really at risk for heat. Every year we lose some young athletes. They're exercising in this heat and humidity, and the combination of heat and humidity means your sweat doesn't evaporate from your skin. You can't cool down, and even young people die. But particularly at risk are older people, particularly older people who live in the city where it doesn't cool down in the evening, and if they don't have access to cooling or air conditioning, they're particularly vulnerable. Detroit is likely to feel like the panhandle of Texas if we don't start reducing our emissions. And these are the projections of extreme heat days with a heat index above 105 going forward. In 2000, we had about 2 a year in Detroit. In 2030, they expect to have 12. And by mid-century, 23. So we have to learn how to deal with extreme heat. And again, this is a story of disparities. If you look at these traditionally redlined areas, these are the areas that have a lot of concrete and asphalt. That does not cool down in the evening. It holds the heat. That's that urban heat island effect. And you'll notice the outlying areas are the areas that have green spaces, and that area does cool down, and the difference between the outer and inner cities are huge. So that's the urban heat island effect, again, a consequence of a traditional historic redlining. And then one last group that we don't think about too often are our seasonal outdoor workers. And I have a quick story on that one. And this is Jorge's story. This is actually told by a fellow clinician from Florida. It's a warm and humid day in the summer when Jorge, a Spanish-speaking seasonal farm worker who with type 2 diabetes and borderline renal insufficiency, presents to your clinic. He's thirsty, weakness, he has weakness, nausea, fatigue, headache, and he's brought in by his wife, who says when he got home early from work today, he seemed to be confused and repeating tasks for no apparent reason. In clinic, he was tachycardic, had a pulse of 110, increased core temperature 100.3. His skin was moist, and his wife tells you, and this is the key, his wife tells you that he frequently becomes ill after long days of work, and that it takes him a few days off and he gets better. But as he always says, rain or shine, cold or heat, Jorge has to work. So this is a story of a diabetic patient with borderline renal insufficiency. He goes out into the heat and he's dehydrated and he's not given the appropriate protections, and his borderline renal insufficiency turns to renal failure. And it goes back and forth, and that's our chronic kidney, the CKI. So these are real stories of real people who have real consequences. So again, think about your outdoor workers, think about your patients who don't have access to cooling in the evening, and help them figure out how to deal with things, and please share your story if you have it. And last group we're going to talk about now is, well, second to the last, is changes in vector-borne diseases. And just like longer allergy seasons, we have these warmer, wetter conditions means that we have more exposure to mosquitoes, more exposure to ticks. They come out earlier, and those that carry some sort of infectious agent actually have increased quantity of those as things get hotter and warmer. The number of mosquito days increases. In Traverse City, according to Climate Central, it's increased 27 days between 1979 and 2022. And what happens in Michigan area, typically it's West Nile disease we're seeing increased numbers of cases of. But what we need to be thinking about as clinicians is the fact that a lot of our patients travel. So I wanted to highlight this story told by one of our colleagues from Ann Arbor, who said this. She said this in the New York Times. I hate mosquitoes so much that I take my own bug repellent to parties. But in early March, when she traveled to an island in Venezuela, she got caught off guard by insect bites after she was told that mosquitoes would not appear until late summer. Near the end of her vacation, her legs began to ache, her ribs felt broken as if smashed against a large boulder, and later in the day, she had intense fever alternating with shaking chills. Back in Michigan, she was weak, nauseated, dehydrated from explosive diarrhea, and ended up in the emergency department. Tests showed worrisome white blood levels and abnormal liver studies. The physician assistant was perplexed. She was given IV fluids, medication, and sent home. She developed a rash and a bunch of other things. Her primary care doctor had no answers. But when she started to get a little bit better, she said, give me a test for dengue fever. So she had dengue fever, not common here, obviously, unless you have somebody who's traveled to the south. But the Aedes aegypti mosquito is traveling further and further north, and the number of cases are increasing. So as clinicians, we have to think about that. I wanted to tell that story too, because she did such a beautiful job describing the symptoms and helping you feel what it would be like if you had dengue fever. So that ability to describe the symptoms is really helpful when you're telling your story. And then we're going to have another story here. because in just a second, what we also know is that the geographic distribution of ticks that carry Lyme disease is spreading. And part of that is related to climate change, the warmer temperatures. In 1988, only 5 counties carried the blackleg tick. By 2021, 22 counties in Michigan did. This is the classic bullseye rash. My son had this rash after being bitten, and it didn't really look like that. It was just a red blotch, but it's a telltale sign. So we have the good fortune, and I'm going to stop sharing, and we'll pin Maya to talk to us. Maya, I wanted to tell you, just because she has is so impressive. She was the 2023 Youth Climate Leader, won the Youth Climate Leader Award from MiCCA's. She's from Kalamazoo, and she's going to tell us her story about Lyme disease. So I will shut up for a second and we'll switch it over to her.
All right, let me know when you're all set.
I think we're all set except for figuring out how to pin you, and we'll figure that out while you're talking.
Okay, sounds good. Well, hi everyone. Like Lisa said, my name is Maya Resna, and I'm a high school climate activist from the Kalamazoo area. And my climate health story started about 5 years ago during the summer of 2019. The summer started like any other, and my sister and I loved to spend the sunny days playing on the 4 acres of our then home. And while we did have a fair amount of tall grasses, ticks were rare, and Lyme disease was never really on our minds. All that changed very quickly. It was a hot evening in June when I found the first rash. It was under my arm and still a fairly small ring, so my mom and I wrote it off as just another bad bug bite. Over the next few weeks, though, it got bigger. The ring expanded to cover half my chest and back, and we had just begun questioning our cortisone cream when it finally faded. I was back to normal a few days later, and we thought nothing of it. However, a week after that initial rash, I got sick. Over 5 days, my fever climbed to 103 degrees, and at 13 years old, my joints ached like a 70-year-old woman with arthritis. It seemed like a typical bad summer flu, though, so again, we thought nothing of it. Over the following weeks, the alarm bells started going off with my mom. We went through another cycle of rashes, fevers, and joint pain, and this time we went straight to the doctor. They diagnosed me with a viral rash, and in a few days, I was feeling better again. But then there was a new rash, and then another. The fevers came back a third time, worse than before. Again, we went to the doctor, and again, they sent us away. But this time, I didn't get better. The fever persisted, and I was condemned to the couch. At this point, Mom had her suspicions about Lyme disease, and having a PhD in cell biology, she took it upon herself to read up on Lyme diagnosis and treatment. We came to my third appointment armed with peer-reviewed primary literature articles on the clinical presentations and diagnosis of Lyme disease and CDC guidelines for its diagnosis and treatment. Before breaking out the big guns, though, we updated the nurse on my history of the last 2 months. Still, she insisted I had a viral rash. This appointment in particular, I will never forget, because sitting on that hospital bed, 2 very clear bullseye rashes covering my stomach and with picture proof of the previous 2, that nurse looked me in the eyes and said, "Don't worry. I've seen hundreds of cases like this already this season. It's nothing to worry about." Of course, that's when Mom broke out the big guns. She knew I had Lyme disease. I knew I had Lyme disease. A standard Google search knew I had Lyme disease, and still that nurse refused. Finally, she broke. "Fine," she said, "but I'm only ordering the test to satisfy you, Mom. I'm not ordering it because I think she has Lyme disease." I got my blood drawn that day, and my test came back quite literally the most positive that positive can be. However, they still wouldn't prescribe me the full CDC recommended dose duration of doxycycline, and so we put another appointment on the books to hopefully extend it. By the next appointment, Mom's stack of Lyme literature had grown, and we prepared for what we knew would be another fight. Just as we suspected, the doctor initially refused. After some back and forth, Mom asked me to leave the room, and I sat in the front lobby, a scared and confused now 14-year-old, while my mom discussed an extended doxycycline dose with the doctor. While I don't know exactly what was said in that room, once we got the dose, we never returned to that office. My symptoms went away almost immediately with the extended dose. We went on with everyday life, and we thought I was cured. But then I entered high school, and slowly but surely those symptoms returned. First it was an ankle, then a knee, then an elbow. I was quickly declining back into 70-year-old grandma. This time we went straight to the experts, and my mom made an appointment at a highly ranked university hospital's infectious disease department with an MD PhD who specialized in tick-borne diseases. We saw him twice, and both times he refused to believe that chronic Lyme exists, provided no treatment plan, and told me to, and I quote, keep on keeping on. With no traditional medicine doctors left, we visited all 3 functional medicine Lyme offices in southern Michigan, each with increasingly ridiculous stories and absolutely zero help. I now have to leave the state of Michigan to receive adequate Lyme literate care. We've been with the same functional medicine office for about 3 years now, and although I'm no longer in a state of imminent crisis, I am not cured of Lyme. I never will be. My health has ebbed and flowed, as does any Lyme patients, and due to especially bad relapses, I've had to miss 2 months of high school, twice. Though we've now found adequate care, this battle hasn't gotten any easier. Because of the delay in my treatment, the Lyme virus and my 3 other co-infections have now impacted almost every aspect of my life. Some days I'm too fatigued to get out of bed. Other days my knees are so swollen and painful I can't walk. It's taken a toll on my mental health too, and I've had to start on antidepressants and anti-anxiety medications. My memory has worsened, and so has my stamina. I get headaches and back pain, and my skin stings if I'm out in the sun for too long. I also get almost every sickness that goes around thanks to my preoccupied immune system, and daily I take around 40 pills. However, I'm still one of the lucky ones. I got a diagnosis. Lyme disease, especially chronic Lyme, is no small beast, and it's only because of my mom's educational background, her advocacy for my care, and our family's socioeconomic status that I'm creeping closer to better. But what about the others? The ones that listened to the nurse the first time? It shouldn't be up to patients to dig through primary literature and read up on the diagnosis and treatment of a disease that's becoming so common due to climate change, especially when they're dealing with chronic symptoms like mine. We need our doctors to acknowledge the effect of climate change on our health and environment and be prepared to see and diagnose the effects in their clinic. After all, what's one small test compared to a lifetime of Lyme? Thank you.
Wow. I am so sorry you went through those and still are going through that experience. It's huge. And thank you for sharing your story, because I'm sure everybody here is going to think much more seriously about Lyme. And by sharing your story, you're educating all of us and increasing all of our awareness. So huge, huge thank you to you. And that brings us to, I'm going to close out talking about mental health impacts of climate change. So when we think about mental health impacts, I think we just, we've heard about the physical impacts that Maya experienced, but she was very candid and forthcoming about the fact that it takes a mental toll, very understandably as well. And many, many aspects of climate change do. I think probably everybody here suffers climate anxiety. And I think for me, that's why I do much of what I do. Action is an antidote to despair, but it also creates
slides for us if you want to.
Oh, I thought I was. I'm just going through yapping away. Sorry, I thought I had it shared.
Sorry to interrupt.
Thank you. Oh, no, totally fine. Thank you for doing that. Let's see where I am. From the current slide, let's see. Okay, can you see mental health impacts now? Yes?
Yep, you're all good.
Okay. So, we've been talking a lot about extreme weather events, and when there is, the hurricane, a tornado like happened in my hometown of Kentucky over Christmas that flattened, a street about a block from where I grew up. These people are forced to move from their homes like incredibly suddenly, and it is incredibly stressful. Especially to children. Their parents are in, very compromised situation. They everything they know and trusted has changed. They have to go to new schools. So the whole family is put in a situation in which things are more stressful. And that's a great example of a mental health impact of climate change. We also have to think about our homeless people and people who carry a chronic diagnosis of some sort of mental illness. Our homeless population in particular tend to be very vulnerable to extreme weather events and to food insecurity, which we know is getting worse with climate change. And many of our mentally ill patients are on antipsychotics, which can actually make it harder for the body to regulate heat. And some of the antidepressants and antipsychotics actually are less effective in extreme heat. And when it's hot, nearly all people tend to become more violent, more agitated, and more aggressive. So one quick story told by one of our medical students in MiCCA. She was caring for a VA patient with bipolar disease who was trying to take the bus to a psychiatry appointment. It was 90 degrees outside, and he didn't realize the bus stop had moved. So he tried to walk a mile to the next stop in the heat, but he became dehydrated and confused along the way. He ended up missing his appointment, and his condition continued to deteriorate in the heat the following days. And he ultimately was admitted to the hospital because he couldn't get back to equilibrium, and he was severely dehydrated. So just another example of climate impact in the form of mental health. And when you're thinking about our workshop, maybe think about your mentally ill patients or your patients with climate anxiety. Again, the key to climate anxiety, in my opinion, is collective action. And so just a plug for what will come probably in a month or two, we're going to do a Climate 102, and we're going to talk about what we can do to address climate change. Normally, when I give lectures, I always talk about how we can address climate. But for you guys, since you know this stuff, I'm not going to do it except for one thing, because I can't help myself. Probably the number one thing we can do to protect the health of ourselves and our patients is making sure that we vote. Voting is a social determinant of health, and we all need to get out there and vote in every single election and ask our candidates questions about climate change and health and environment, etc. So I am going to stop now. I'm going to stop sharing, and we have the good fortune to have Pavan from the Michigan Environmental Justice Coalition to talk about his take on storytelling and how our stories might be able to help some of their efforts. Pavan?
Yeah, thanks a lot, Lisa, and thanks for this wonderful presentation. And thanks to everyone for coming on a Thursday afternoon. This is a really important topic, and I really appreciate everyone's presence here. My name is Pavan Vangipuram. I'm the Communications Director at Michigan Environmental Justice Coalition. I use he, him pronouns. And I wanted to talk very briefly. I don't have very prepared remarks, so please forgive me if it's a bit off the cuff here. I wanted to talk briefly about what MEJC is up to when it comes to storytelling and where our priorities are. I wanted to talk a little bit about what a good story sounds like and looks like, and what kind of stories that we at MEJC would be interested in telling, and how perhaps some of the folks on this call might be able to assist us in this. And I finally wanted to leave some room for folks to reach out to me individually if they have a story that they think is apropos or would just like to learn more about storytelling. So Michigan Environmental Justice Coalition is involved in organizing environmental justice communities. These are Black, Brown, Indigenous, and low-income communities that have traditionally borne the brunt of climate change and the pollution that causes it. The ill effects of climate change and the pollution that causes it, I should say. And a lot of these ill effects are items that we've been discussing right on this call. So these are increased rates of asthma, increased rates of various other health issues. And these are specifically because of their proximity to point source pollution and because of various different environmental injustices. And what we find is that the communities that are most affected by these environmental depredations tend to be the communities that have seen systematic oppressions in other aspects of American life. And so these oppressions tend to compound on one another. And so these communities are not only dealing with disproportionate health impacts, they're dealing with disproportionate economic impacts and disproportionate educational impacts, etc. Now, why is storytelling so important? I should say that Michigan Environmental Justice Coalition, one of our major adversaries or villains is DTE. That is the major energy monopoly that serves most of our environmental justice communities. And they have had some business practices, let's say, that have been very deleterious to environmental justice communities. We're talking specifically about their insistence on using dirty fossil fuels in order to generate electricity. And we're also talking about their high rates that is an economic injustice and their very poor service. And why are our stories important? Because DTE has its own story. DTE has its own narrative about what a wonderful company they are and how much great work that they are doing for Detroit and for Michigan. And they have a lot of resources. They have many, many resources in order to get that story into the ears of lawmakers and into the ears of those who are making decisions. And if we are not there with our stories that are truly authentic and that tell the true impacts that companies like DTE and others are having on our communities, then those will be the only stories that the decision makers are hearing as a story that DTE is telling. And that is a story that is not serving our communities. That is not a story that is not serving environmental justice. That is a story that is serving DTE's corporate interests. This is America. This is a free country. They have a right to tell their story, but we have a right to tell ours too. And it's very important that our story gets also as much play and as much attention as their stories. We are not DTE. We don't have the resources to spend millions of dollars on advertising and to go to Lansing. But what we do have is the power of our authenticity. And that's what these stories that we are discussing today that are being, sorry, checking the chat. And that is why our stories are important. And so now to move to my second point as to what are the types of stories that we're talking about. And a lot of these stories have already been told on this call. And as clinicians, you all are professionals. You see these stories every day. And these are stories of folks who have suffered a power outage, let's say. They are on a CPAP machine. And this power outage causes them a great deal of anxiety and consternation because they're not sure, whether they will be able to power this machine through the night. This causes them a lot of cost, right? They have to go to a hotel now because they need power. This costs them a lot of fear. Their mental health is affected. This may cost them money. They're not able to work properly because they had to go to this hotel. This is all the result of a single power outage as a result of DTE's negligence, let's say, when it comes to fixing the grid. Now, why are these stories so powerful? Because it is a true human impact. We are human beings and we feel empathy. When I heard Maya's story, this is terrible. I can feel in some way Maya's pain. And this is what we want to be able to express to others, that these are real human impacts. When we have a power outage, when DTE chooses to burn fossil fuels in order to generate electricity, and that power plant is right next to a community, that community has increased rates of asthma. What are the human impacts of that? How does that make people feel? What is the impact on a family, when they live next to a power plant? Those are the stories that will be able to move lawmakers. Those are the stories that will be able to move decision makers. Not only that, but those are the stories that will bring communities together, because we must not suffer alone. If I am finding a problem, that I'm having an issue, others very likely are having those issues too. And when we tell our stories, we are able to connect to others who are having similar problems, similar issues. And we're able to provide a sense of hope, togetherness, belonging, community, and joining that together, we're able to amplify the power of the stories. And so that is why storytelling is very important, and that is why those are the sort of the types of stories that we're looking for, the real human impact that a power outage might have, the real human impact that a proximity to a point source of pollution might have. And those are the stories that if we are able to respectfully collect and promulgate, we'll be able to get like positive policy outcomes. And the last thing I want to say is that respect is the kind of the utmost aspect of storytelling and story collection. And we have to really be like very cognizant of the fact that these individuals are telling their stories, and this is something that's very personal. They are donating their lives in a real sense, in the hope that this donation will engender some good and will help folks not have to go through what they went through. But in that, like, we have to be like stewards of that, like very responsible stewards. And that's something that I know that everyone here takes very seriously. And so that's all the remarks I really had prepared. But what I would like to do is leave in the chat my contact info. That would be my email address. And what I would really, really hope is that folks would be able to reach out to me if they have a particular story or a particular patient that they would like to get into contact with. If you'll give me one moment, I'm just going to put it in the chat right now. And I would also want to give a quick plug to a storytelling event that Michigan Environmental Justice Coalition is diligently planning. We have a tentative date of July 20th. It'll be at a really like chill like coffee shop / bookstore. So it's not like going to be this like massive like gala thing, but it'll be like this really cute intimate affair where we'll have a little stage and like folks will be able to come up and tell their story about like how DTE's policies and like it's called like voices from the outages, right? So like how DTE's practices have affected them personally, whether it's through a power outage or whether it's through high rates, whether it's through proximity to air pollution and things like that. So we're really, really interested in interacting with everyone, and like hopefully we'll be able to work together. And that's all I have. Thank you very much for your time, everyone. I really appreciate it.
Beautifully said, Pavan. Thank you so much. Really appreciate your time. Lauren, do you want to take it from here? And I will, while you're doing that, I will try to share my screen again and put the CME stuff in there. But again, a big, big thank you to Pavan and to Maya and to Jada, who isn't here, and Kaylee. For sharing their insights and their stories, especially a big one to Maya and to Jada, who actually told personal stories that they experienced. That's really huge and greatly appreciative. And you're up, Lauren, and I'm going to try to figure out how to share my screen while you do that.
Yeah, thank you again to all the speakers, and thank you, Lisa, for that, for all that information. We know it was a lot of information, and we're super grateful that you're all still here with us. Luckily, the next thing we're gonna do is a breakout room session. It's gonna be a moment of kind of pair share. So what we're gonna do is put you in groups of 2 and also share our Google form, which is a list of the questions that Lisa covered, those multiple topics, the multiple ways that you might have seen climate change affect your practice, whether you registered it that way in the moment or not. I know there's lots of students on this call too. We shared the personal Google form as well. So that's questions about maybe your own life or your patient. So the purpose of the pair share is to tell a story, to share with the person that you end up with about how you've witnessed this in your own practice. You're also obviously welcome to just talk about the presentation. Yeah, we really appreciate you all being here. We will also have a session aimed just at the kind of action side for anybody who wants to workshop their story. I think I'll just emphasize one more time. We're super grateful for Pavan's account here. I think Lisa's point really brought it home too. Action is what makes this all worth learning about. And so this is just an opportunity to really take our learning into something that affects people's lives. So I'm going to open the breakout rooms without further ado. It'll be about 8 minutes of just being able to share with the person you're in the breakout room with.